So I've got to stratify into the three main symptoms for that. So the cutaneous form basically is an ulcer. So it's a little sore which starts off at the bite site of the mosquito, of the sandfly, and then develops into a slowly growing, expanding ulcerous lesion. There can be multiple ulcers. They can be in the face, on the body. They can be very stigmatizing because they can grow to be very large. They're not really painful, but to diagnose the etiology of such an ulcer, you need to make a little skin snip and look for the parasites within. It's very responsive to treatment. There are some spontaneous remissions, which is also quite common in the cutaneous form. The mucocutaneous form is a bit more difficult to treat. You distinguish actually between the uncomplicated and the complicated mucocutaneous forms, and they require more dedicated treatment. The cutaneous form can be treated more locally using infiltration of drugs or just thermal or cryotherapy, so local heat or local cold to scarify the lesions, whereas the mucocutaneous form really needs systematic treatment. And the third, the more severe form, the visceral leishmaniasis, causes fever, it causes anemia, it causes inflammatory response, generalized, with enlargement of the liver, of the spleen, and actually can cause a very severe form of disease. However, if you treat it properly and correctly, there is still a probability that you get a skin lesion, a skin disease afterwards, which is called the post-Kala-Azar dermal leishmaniasis, which it's a very interesting disease. There's a bit of an enigmatic disease. Not everything is quite clear about this yet, but it definitely results in a very high parasite load in the skin, which then leads to sandflies taking up parasites again from humans, getting infected and then passing it on to other people. So it's an anthropophilic transmission route.